You couldn't leave this section without looking at the most obvious part of the circulatory system, the heart. It's important to know some of the main parts of the heart. Firstly, remember when you look at a diagram of the heart, the left and the right appear on the opposing side. If this confuses you, hold a diagram of the heart against your body. Label which sides your left and right, and then put it on a table to look at it, and you'll see why this is the case. So, back to the parts of the heart. Some of the parts we need to know are the Vena Cava. This is the main vein that takes the deoxygenated blood that has been around the body and delivers it back to the heart. The Aorta. This takes the oxygenated blood from the heart to the rest of the body. The Pulmonary Artery. This carries the deoxygenated blood from the heart to the lungs. It's the only artery in the body that carries deoxygenated blood, as it's taken it to the lungs, where the hemoglobin combines to the oxygen molecules. The pulmonary vein carries the oxygenated blood from the lungs to the heart, and is an exception, like the pulmonary artery, as it's the only vein that carries oxygenated blood, returning it to the heart from the lungs. Coronary arteries provide the oxygen for the muscle cells of the heart to allow it to pump. Damage or blockages in these arteries can lead to heart attacks. Atrium. The heart has 4 chambers. The top 2 are known as the atriums, and the bottom 2 as the ventricles. You can remember this, as the word atrium begins with an A, which is similar to an arrow pointing upwards, shown there at the top, and the ventricle begins with a V, which is an arrow pointing downwards, and tells you that they're on the bottom. So, go and take the test and see how much you can remember about the parts of the heart.